Oh, okay. Let me join. Let me go talk to him. But let me quickly grab a coffee,
Okay.
and I'll
All
be
right.
there soon.
All right.
Yeah. Okay. Hey, Sanjay.
Hello, Kanni. How are you?
Very good. How are you doing?
I'm all right.
And what kind of coffee do you enjoy drinking?
I'm not one of these people who insists on having a coffee that's exactly according to specifications. I'm quite flexible.
Good. Good.
But right now, I'm drinking some coffee made in a French press machine, or rather device, which we've settled on because it's just a very simple method, very easy to make coffee, and it's very reliable. So I'm doing that, and it's, I think, mainly Colombian coffee, which I'm drinking here. So
Yeah. No,
cheers.
cheers. Cheers. Indeed. No, we've been trying different beans, and with droughts in different parts of the world. I mean, just look at Brazil, right? And then what's going on with coffee markets. I mean, you're lucky if you got into coffee futures early, so that you could ride it out. But otherwise, we're going to see that morning cup of coffee is going to get very expensive.
Well, that's interesting. I know that there's been a bit of commodities boom in recent times, but of course, coffee production has also widened geographically quite a bit, with some countries coming in, such as Vietnam, for instance,
Yeah,
which really were not coffee producers historically, and now they're making quite a big contribution to the coffee crop
that's very,
worldwide.
that's very true. That's a good segue, I think, into the differences in how not just countries responded to the pandemic, but also certain communities or even localities.
Well, I think that one of the big lessons of this pandemic has been that states have really been very poor at anticipating what could happen. Of course, no one can tell the future, and no one is expecting a correct prediction of exactly will happen. That's unrealistic to expect of individuals, to expect of organizations or of governments. But what one can do, at least, is to do some anticipation of possible scenarios that could arise, and to map or to chart what are the kinds of issues which would have to be considered if those scenarios were to arise, what kinds of capabilities would need to be in place to address them.
And I was living in Vietnam during SARS and during that lockdown. And they had to move very quickly out of a health only focus, to looking at the whole of community well being, and then economic issues because airspace shut down, tourism went out the window. So there were a lot of, and you can't just shut people down at home, as we've seen in many places. So that's another, to me, issue that you brought up, which I found very compelling. Most of our countries have multiple ad hoc social protection measures, right? And some of them, okay, add up to a good enough scale and coverage, but the majority don't. And you've talked about a standing architecture for this. Tell me a little bit what you had in mind.
I think that social safety nets, crucially, are not needed only in ordinary times, but they're needed in times of crisis, and especially, in fact, in times of crisis. This situation of a pandemic and of crises generally really does underline an additional dimension of the value of universality, which has been neglected perhaps in those earlier discussions, which is that one doesn't have to collect information about who is vulnerable or who has been hit when a crisis hits, in this case, the pandemic, if one has a universal scheme. For instance, the German Kurzarbeit scheme, which many people have seen as having functioned very effectively in this pandemic, which provides subventions to firms to encourage them to keep people on the payroll so that they don't become unemployed. That is obviously something that's going to especially benefit people who are at risk of becoming unemployed. On the other hand, it's a scheme which is available to all firms and all employees, more or less, as I understand it.
If you're facing a leader of government that says there's just not enough cash to go around, what would you say?
We've seen enormous fiscal expenditure in response to the pandemic, differently in different countries, of course. The size of the fiscal packages has been much greater in the developed countries than in the developing countries by and large. But nevertheless, there has been some flexibility that's been exploited. The International Monetary Fund and others have actually encouraged that in this pandemic and argued for a much more flexible stance. So the very idea of a constraint is placed in question when one has good reasons to do something which one ought to do, as is, I think, almost universally acknowledged in the case of this pandemic, that there has been an exceptional situation which has demanded a response by government and supports for particular sections of the population. There are other cases where I think some of the trust which has been drawn upon successfully, East Asian countries in particular, which had experiences of prior pandemics, able to draw on the fact that there was a reservoir of trust in government based on prior public communication, which had been well received. When there is distrust in government, then simply presenting a diktat that one must do such and such without really addressing the underlying suspicions and providing reasons which people can understand is not going to be, it seems to me, wholly successful. So what we should aim for is something closer to social dialogue.
In your sense of taking what we've just talked about and now pushing it back up to a global level, what for you come forward as some truths that have to be told?
Well, I think that this is clearly an episode in which there has been a colossal failure of coordination globally. I think it's extremely hard to see what has happened as a success or a first best. It's obvious it's at best a second best, maybe a third or fourth or fifth best, falling very far short, in other words, of what should have been done and could have been done. And this is evident in various aspects. Obviously, the early surveillance of the disease and response to it globally, but also, of course, the development of a vaccine and the supply of a vaccine on a global scale adequately, but also of tests and therapies. There's also been, I think, a failure of joint or collaborative decision-making with respect to the kinds of spillovers that were being generated by individual countries' actions upon other countries and how those could be adequately addressed. We really saw missing leadership at the international level, missing coordination, missing measures. I think when one is faced with an unprecedented situation of this kind, in which one doesn't quite know what one has been hit by, and one is learning on a day-to-day basis what is the nature of the virus, for instance, how it is transmitted, and that is also changing over time. Just to give one example, one has to have mechanisms of collecting the information, identifying lessons, revising those lessons, and changing one's response. Right? So policymaking has to be very supple. It has to be flexible. It has to be responsive and rapidly so. And it has to be, to use your reference to a science-based decision-making earlier, it also has to be evidence gathering. There have to be mechanisms in place to gather the evidence and make sense of it within policymaking, to share it across countries where necessary, and so forth. Now, I don't think we've had those mechanisms of learning and learning to learn as much as we could have had. I think that the standardization of data collection, for instance, and data sharing according to standardized protocols was something that really was lacking to a considerable extent. The development of means of collecting information, such as randomized surveys of the population to determine the true prevalence of the disease, almost non-existent. These are elementary things which could have been put in place and would have been very valuable for policymaking.
A very optimistic way to close this conversation, because what you put your finger on just now is things that are well within our reach. These are things, we're not waiting for a new technology or something that hasn't been discovered yet. We've got this set of tools in our arsenal. We've just been choosing not to use them, right? And if we choose differently, then, as you said, maybe we can make better, more informed, more just, more value-driven choices.
These kinds of iteration, adjustment, learning are really important for future policymaking.
Thank you. Thank you again, Sanjay, and enjoy your coffee.
Look forward to seeing you soon.
Absolutely. Bye-bye.